We use soccer to engage adolescents and young people in the most taboo topics. These include HIV and AIDS, gender-based violence, gender equality, and also issues around cervical cancer as well as HPV vaccine. We do realize that adolescents and young people learn things or remember things quickly when they are learning and having fun. I pretty much started out as a beneficiary, and so I lived in a very underprivileged community where I noticed adolescents and young people did not have access not only to services, but also the information was not available. And when I learned that Grassroot Soccer had come through in my community, I was very excited. I have been involved with Grassroot Soccer for 7 years now. And my favorite part about Grassroot Soccer is really working with the young people. We leverage on the power of soccer to equip young people with life-saving information and mentorship needed for their well-being. So when they come through to our skills program, we're able to use play-based method because we understand that using the power of soccer really makes messages more sticky and they're able to remember the messages. When these participants come to our sessions, we ensure that they feel comfortable and they feel that whatsoever they speak about is something that they can know that won't go outside of the session. I believe solutions are within the community, and the fact that our interventions really happen in the different communities, both in school and for out of school adolescents, I think that's what makes it more unique.
We want to see a society where young people are empowered with information. The greatest impact I think that we have as an organization is that we've been able to deliver life-saving information to the adolescents and young people on different SRHR issues as well as mental health. In Zambia, some of the challenges that we face when it comes to health for the adolescents and young people is that when you come to the urban parts of the country, the young people have access to the different services. But when you go in the remote parts of the country, I think the challenge that we have is that even when the young people want to access the services, sometimes the services are not available. The young people need to know that they can access HPV vaccine.
So when we talk about HPV, that acronym stands for human papilloma virus, cervical cancer. It's indeed a public health problem here in Zambia. We have got one of the highest incident rates globally. Cervical cancer is purely a cancer which is preventable. It is the cancer which we can even cure. Vaccination and screening, they are able to prevent more than 90% of cervical cancer. We need to go into the community. Organizations such as Grassroot, they also help a lot mobilizing both the girls so that they could be going for vaccination and also for the women so that they could be going for screening.
I was 14 years old when I was a participant at Grassroot Soccer. I learned a lot of topics, which one includes how to prevent myself from contracting HIV and how I can prevent myself from having cervical cancer. I wasn't able to get the services on my own, mostly at the times where young people are being condemned and judged. Through the help of Grassroot Soccer, I was able to get an HIV testing and HPV vaccine. I personally have developed self-confidence and I'm courageous enough to share the information that I have learned to the community, friends and families.
Once they have this information, we want to see young people empowered to make decisions to access health services. Because once they access health services, that their health outcomes are going to improve significantly. So we want to see communities where young people, apart from being empowered with information, they are able to access the different SRH services, mental health services, that includes HPV vaccine for the younger adolescents.
Get your